Hi everyone. Welcome to our webinar today titled Planning Sustainable Meetings and Conferences for Healthcare. My name is Yusra and I'm a research assistant with Peach Health Ontario. And on behalf of Peach and the Canadian Coalition for Green Healthcare, we'd like to welcome you to today's webinar. We have wonderful speakers today, and before we begin, I'd just like to do an acknowledgement with respect to Indigenous peoples and communities whose historical relationships with the land continue to this day, and on whose traditional territories all of our work does take place. And so we acknowledge a debt to those here before us and recognize our responsibility as guests to respect and honor the intimate relationships Indigenous people have with this land. So that's kind of everything on my end of things. I think I have one slide just on logistics with the webinar. So throughout the webinar, if you have comments to share and just like small emoticons here and there, please use the chat function, and also for any technological experiences you may be having. When we move into the Q&A session, we ask that you use the actual Q&A panel on the chat function to have the questions for your panelists, just so it's all in one place for us. And with that, I will pass the mic to Fiona to get us started.
Thank you, Yusra. Okay, I'm just going to share my screen. All right, can everyone see that? Just give me a thumbs up. Yeah, okay. Great. Okay, well, thank you everyone for joining us today for our webinar talking about sustainable meetings and conferences within healthcare. So we'll just go over the agenda quickly. So we're going to start by talking about who's speaking today. I'm going to give you a bit of a background on Peach and our Sustainable Food Committee. We're going to go over what sustainable events are, like what the standards are within meetings and events and why those are needed. And also talking about shifts that are currently happening within healthcare, what is being done in relation to sustainable events and conferences and meetings and stuff like that. And then we'll go into what Peach Health Ontario is planning, and the end we will finish with a bit of audience participation. So the objectives of our session today are, at the end of the session today, we hope that you are able to understand the need for sustainable standards for events and meetings within healthcare. We hope that you understand the development process of our guidelines. And at the end of the session, we are looking forward to collaborating with you on what should be included in the guidelines that we are looking to create. So our speakers today, we have 3 speakers and 2 advisors who helped us create these slides. Myself, I'm Fiona Paris-Gandolo. I am the research coordinator for Peach Health Ontario. For those who aren't familiar with Peach, Peach stands for Partnerships for Environmental Action by Communities Within Healthcare Systems. In this role, I co-chair our Sustainable Food Committee. Our next speaker is Dr. Zara Kassam. She is a radiation oncologist, and she's also the co-founder and director of Plant-Based Canada. And our third speaker today is Leanne Blake, and she is a medical student with the Schulich School of Medicine and Dentistry. Thank you very much for both of you being here today. We also have 2 advisors. One is Casey. She is a medical student at McMaster. She also has a Master's of Public Health where she studied food systems. And Amy Ford, who is the Director of Planetary Health at Nourish. So I'm going to start off today by just going over a bit of a background of where all these thoughts and concepts that we're going to be going over today kind of came from. So a couple of years ago, Peach Health Ontario did an evaluation of greenhouse gas emissions at a 200-bed hospital facility. And what we were looking at here is different areas where we saw lots of emissions and where we saw that action could be taken by the facility or by staff to reduce those emissions and to reduce the general environmental footprint of the facility. So some of the things that stood out were sustainable procurement, water refill stations, and offering a plant-rich menu. So from those items, we created the Peach Sustainable Food Committee. The Sustainable Food Committee brings together healthcare workers from across various areas of healthcare that are all dedicated and passionate about creating sustainable food systems within a healthcare setting. Last year, we did a project where we created a business case and implementation guide looking at implementing a sustainable menu within hospitals and long-term care facilities. So what we were looking to do was create kind of like a guideline or a step-by-step process for healthcare leadership to understand why food should be a focus when we are trying to transition our healthcare system into a more sustainable net zero operation. So within that guideline or within that business case and implementation guide, which I will link in the chat at some point. I just can't see the chat right now, so I'll do that after. But in that document, we created 4 pillars, and we found that these were things that came up in our research that were really central to the to offering a sustainable food services model. So these 4 pillars are embracing food as medicine, reducing food waste, implementing plant-forward menus, and shifting to value-based procurement. And then these items kind of shape the mindset of the committee and a lot of the work that we do. So what exactly are sustainable conferences and event standards? So we are viewing these and kind of defining these as guidelines on how to organize events with sustainability at their core, a compilation of evidence-based actions and performance metrics, guidance on how to facilitate structured events, and education for organizers detailing the before, during, and after meetings and events that they can, so steps and processes within those 3 areas that they can implement into their planning and their strategies. I'm going to pass it to Leanne.
So hi everyone, my name is Leanne, and the first question we want to talk about is sort of why is this needed within healthcare? So on to the next slide, we have a focus on the community impact. So when we think about conferences, we need to think about the volume of participants. So in-person events and meetings are common in healthcare and often include hundreds to thousands of participants. So for example, the College of Health Leaders, CCHL National Conference has over 800 attendees. Ontario First Responders Mental Health Conference, around 500 attendees per year. Department of Family Medicine bi-monthly department meetings can have over 130 attendees per month. When we think about conferences, there's also various types of meetings that this can include. So healthcare includes many types of meetings at the department level, faculty or facility level, conferences, educational workshops, community settings, etc. And we also need to think about healthcare institutions as anchor institutions. So this means that they invest in their surrounding communities as a way of doing business, and they have substantial assets that can be used for community wealth building, as well as they having an economic self-interest in ensuring their communities are safe and healthy. And their actions influence policy and practices across communities and spill over into other industries. So next, so just some staggering facts on healthcare emissions production. So Canada is ranked within the top 10 global polluters for healthcare. The healthcare sector is responsible for approximately 4.6% of global greenhouse gas emissions. And if healthcare were a country, it would be the 5th largest emitter on the planet. When we think about conference attendance emissions production, we first need to think about the travel to conferences. So research suggests that the annual carbon footprint for the global event industry equals the same order of magnitude as the yearly greenhouse gas emissions of the entire United States, responsible for more than 10% of global CO2 emissions. Conference travel itself can account up to 35% of a researcher's total carbon footprint. And it has been found that 10 to 20% of participants with the most polluting trips contribute to a substantial portion, around 20 to 70% of the total transportation-induced emissions for a single event or conference. And then there's the individual footprint. So due to a difference in assumptions associated with in-person conferences, being different in regards to the duration, size, and location, geographical distribution of participants, the carbon footprint for an individual attending a conference can range from 92 to 3,500 kilograms of CO2 equivalents per person attending. And a single conference can contribute up to 7% of an individual scientist's annual greenhouse gas emissions. And then there's the food and accommodation. So assuming a standard diet that's non-vegetarian or non-vegan, food can contribute 18% of conference carbon footprint in total. So food can contribute to 18% of the conference carbon footprint, and accommodation can account for 13% of conference carbon emissions or footprint. And then when we think about food system and global, this is Zara. I'm passing on to Zara.
Thank you. Hello, everyone. So the next few slides are going to concentrate on the impact of our food system on the planet. So the first slide, we're going to talk about greenhouse gas emissions. And it's really interesting that even though our global food production accounts for 35% of all greenhouse gas emissions, very few of the climate discussions actually talk about food. And that's what I love about, Peach and the Canadian Coalition, that food is such an important aspect of sustainability. But 35% of all greenhouse gas is huge. The animal agriculture industry is responsible for nearly 60% of these emissions. 30% of all methane emissions are actually from the animal agriculture industry. And we know that methane has a global warming potential of 25 times more than carbon dioxide. We know from research, including research by Poor and Nemechek in 2018, that a global shift to plant-based diets could cut food-related greenhouse gas emissions by 50%. And the Lancet Countdown, which provides information on a yearly basis, in their 2024 report on the Canadian stats, stated that in 2021, Canadian consumption of red meat and dairy totaled 69% of the country's total consumption-based emissions, which is absolutely huge. They also estimated that that year there were 14,000 additional deaths due to excess meat and dairy consumption, accounting for 22% of all the diet-related deaths in Canada. So there are co-benefits for health and for the planet in terms of reducing our meat consumption. Next slide, please. So our food system is not only having a negative impact in terms of our greenhouse gas emissions, but it has a broader and wider impact on the planet. Animal agriculture is the leading cause of biodiversity loss, mainly in terms of land use change and deforestation. So animal agriculture is the leading cause of deforestation worldwide and of land use change. Half of all habitable land is used for food production, and 80% of that land is used for animal agriculture specifically, even though it only provides 18% of our calories. So it's an incredibly inefficient system. 3/4 of global deforestation is driven by agriculture, and expansion of pasture land to raise farmed animals is responsible for 41% of tropical deforestation. The other aspect of animal agriculture that is not well discussed is antibiotic resistance. Antibiotic resistance has been named as one of the top 10 global threats to humanity by the World Health Organization. Intensification of meat production increases the use of antibiotics, contributing to antibiotic-resistant bacteria. In Canada, 82% of antimicrobials are used in the animal agriculture industry, and that's 3 times as many as it's used in Europe. So that's definitely something we should be addressing as well. And in addition to these aspects, animal agriculture has a significant negative impact in terms of air pollution, land pollution, and water pollution. Next slide, please. These two graphics really illustrate these points very well. The Venn diagram on the left shows the biomass distribution of land mammals on Earth, and you can see that humans account for 36% of that, farmed animals a whopping 60% of that, and only 4% of the biomass of land mammals on Earth is actually from wild animals. So in the last 50 years or so, we have completely decimated the wild animals on the Earth. The slide graphic on the right is from Our World in Data, which is a wonderful resource from the University of Oxford. And this graphic shows the annual carbon dioxide emissions from deforestation by product in Brazil. So we find deforestation all around the world, but it's especially severe in Brazil. And of course, we know that that's where the majority of the Amazon is. And 80% of the deforestation of the Amazon comes from ranching, from providing land for grazing animals and growing crops to feed them. And this is illustrated really well here. You can see beef along the top in terms of the annual carbon dioxide emissions are multiple times more than any of the plant-based foods listed below that. Next slide, please. So what we eat really matters, and these two graphics provide a good visual of this. The graphic on the left shows that the average diet is along the top and has over 2,000 kilograms of carbon dioxide equivalents per year. As you drop various aspects in the diet, animal products in the diet, you can see that the carbon dioxide equivalent emissions drop. And of course, vegan is the winner right down at the bottom, multiple times less in terms of greenhouse gas emissions. In terms of what milk is best for the planet, we see people talk about this all the time, and we want to have plant-based milks as the default. And the graphic shows that for every litre of milk produced, this graph shows the greenhouse gases, the land use, and the water use. For every litre of cow's milk, you can see that 628 litres of water is needed compared to soy milk, which is at only 28%. 28 litres. So whatever plant milk you choose, you're going to be doing better for the planet. So all these myths that come that, vegans are destroying the Amazon because they're eating too much soy, that's absolutely not true. Only 7% of soy production is for human consumption, and that doesn't generally come from the Amazon. Next slide, please. So with all this in mind, we feel that guidance on practical change is needed in this setting. We want to be able to track progress and impact by monitoring metrics and performance goals. We want to encourage lasting change. We want to promote sustainable habits with attendees and vendors. We want to have these actions align with our global climate and planetary health goals, and we want to promote social responsibility and ethical sourcing. Next slide, please.
Back to Leanne.
So we are already seeing some shifts happening within healthcare, so that there are some current leaders in the field. Hospitals across North America are starting to change their menus, and some notable examples are Vancouver General Hospital, which has introduced more than 20 new delicious, nutritious, more culturally diverse, and environmentally sustainable menu items as part of a planetary health menu pilot project. The project demonstrated a 43% reduction in greenhouse gas emissions, and they also try to source items from local suppliers and create locally inspired menu items. There's also the New York Hospital, which has a plant-based option as the primary dinner option introduced in 2023. And then as of March 2024, they have served over 1.2 million plant-based meals. All meals are made from scratch at the Health Systems Culinary Center in Brooklyn, which shortens supply chains and supports local talents and the economy, of course. And after integrating plant-based into their general menu, there was about 60 cents US saved per plant-based meal served. And 51% of patients chose the plant-based option, and 98 patients were satisfied with the option they were received, and there was a 36% reduction in food-related carbon emissions. And then there's also the Lancet Countdown Report, so Canadian-specific recommendations, which recommending using health systems' purchasing power to drive a shift towards sustainable plant-rich diets that can help cultivate food security and local sustainable food. So this is really relevant, of course, in a Canadian context as well. For example, Quebec Hospital found that red meat accounted for 1/3 of its emissions, but formed only 3% of its menu. So this is happening right here in Canada. Next slide. So more on the shifts that are currently occurring. The American Medical Association, a new policy announced at the 2024 annual general meeting of the AMA House of Delegates, stated that it recognizes the animal-based agriculture is a significant contributor to greenhouse gas emissions and supports efforts to increase and promote plant-based menu options in hospital food services for both health and environmental reasons. And then, of course, there's virtual options. So in a post-COVID-19 world, virtual options are becoming more prominent for conference attendance and are, of course, more sustainable. So what's currently being done? We have the Harvard Sustainable Meeting and Event Guide that has emerged. So it provides guidance for organizing sustainable and healthful catered meals. It Yeah, so it's inclusive meeting tips from Equity, Diversity, and Inclusion and Belonging meeting guide, and includes strategies for incorporating movement, reducing waste, and more. There's also the Equiterre, which is a Quebec or Montreal-based non-profit, which that introduced the 2024-25 Montreal pilot projects for planetary menus at large-scale events to promote the marketing of local sustainable food, education of attendees on impacts of food, and working directly with suppliers. And then there's also the University of Waterloo Sustainable Events Checklist. So this offers action items for campus events, striving for zero waste practices and responsible purchasing to lower impact community and carbon neutrality. To the next slide. There is also Pharmacy Declares, which is a sustainable conference action checklist, which is a pharmacy professional sort of organization based in the UK. So it includes advice on attendance, travel, refreshments, waste management, events, and awards. And then there is Real Zero, which is a nonprofit organization dedicated to catalyzing social and economic change to reduce greenhouse gas emissions at the pace and scale required. So they have a venue questionnaire for on-site conferences to be as low or zero carbon as possible, which covers categories such as energy use, access to low carbon transport like bikes, catering, plastics, and low carbon hotels.
Okay, so now we're going to move on to what the Peach Sustainable Food Services Committee's guide for sustainable meetings and events is going to look like. So the content is going to have both a climate, health, and personal health perspective. So we're going to focus on areas of meetings and events that have the greatest environmental impact and address where improvements can be made or should be made. Since we're looking at meetings and events for healthcare audiences, we're also going to be covering how components relate back to personal health. So these would be benefits to offering plant-based food and improved air quality from promoting active transportation options and increasing virtual participation.
So the core components we want to include in our diet is sustainability, obviously, which we've been speaking to. We want to incorporate inclusivity, which we're going to talk more about shortly. Decision making, how do you support people to make the more sustainable choices? We'll speak more to that in a minute. We want to make the guide adaptable and applicable for a variety of circumstances and situations amongst professional societies, medical associations, health system organizations, as well as patient organizations. We'll also want to discuss the economic and financial aspects and show that there are cost savings that can be made in moving towards more plant-based offerings. Next slide, please. These are the key sections we will be including in our guide. We'll be talking about planning principles for organizers at the beginning of planning of events. We're going to talk about venue selection, what sort of discussions to have with venues on asking them about their sustainability practices and how they can work with you as the organizer to promote sustainability practices that they may not already be doing. There will be obviously sections on food and beverage, waste reduction, inclusivity and accessibility, which we're going to talk to shortly. We'll include a section on communications, how to share sustainability efforts before the event, during the event, and after the event. And evaluation and feedback is obviously very important. Collecting data and key metrics is important, looking to see if the actions taken are actually benefiting in terms of metrics like greenhouse gas emissions and also participant satisfaction. Next slide, please. In terms of the food and beverage section, we want to think about what kind of actions can help people make sustainable choices. We love the Greener by Default principles. Greener by Default is an organization based in the US that aims to work to flip the norm. So currently, meat-based meals are the norm. You will go to a conference or event and it will be meat-based offerings. And if you want a vegetarian, plant-based or vegan option, you will have to ask for that specifically, or there'll be just very little of it. And what Greener by Default want to do is flip the norm so that plant-based options are the default, and that you as a participant, one of the ways might be that you would have to ask for the meat option as a specific action. So that can be done in different ways. It could be done, for example, before the conference, you RSVP and then put your request in at that point, or it will be done at the conference site where most of the offerings are plant-based and the meat section might be in a separate section or somewhere harder to get. There'll be plant-based milks as defaults, for example. Other ways to incorporate this as default would be not to have vegetarian vegan options as a separate on the menu, for example, so you incorporate that into the main offerings. You don't label things as vegan or vegetarian because this can be off-putting to people. Even some data suggests that labeling a meal sustainable might be off-putting. So you bring those plant-based meals into the main offering, you describe them based on their ingredients, and you attach experiential descriptors to it, such as, you know, your hearty meal or your juicy burger, for example, so that these are available to everyone and people don't look at them as, I can only have the vegetarian option because I identify as a vegan or a vegetarian. And sometimes by labeling it that way, people are being altruistic. Participants don't want to take the vegan or vegetarian option because they think they're taking that away from their vegan vegetarian colleagues, but actually we want these plant-based options to be available for everybody. Reducing food waste is important, which we'll talk to in the next slide. We want to discuss the option of including the universal meals principle. So this is a wonderful concept by Physicians Committee for Responsible Medicine. And they talk about the fact that food is dictated by religious backgrounds as well. So there are religions that will exclude certain foods. Now we're having more and more people choosing plant-based based on ethical reasons for the environment, for animal justice. We have people who are choosing plant-based options for health and don't actually want to eat red meat or meat at these meetings. And we have people who have allergens. And universal meals take all these principles into consideration. They offer recipes which exclude the top 9 allergens, which will include meat products like eggs and fish and dairy. We know that 70% of our global population is lactose intolerant or has a degree of lactose intolerance. Things like nuts and sesame, gluten, for example. So these universal meals exclude all of that. So that could be something that people talk to their venues about, or if that's not possible, asking the caterers to label the top allergens. So that's part of inclusivity and being able to be welcoming to all participants. And as Fiona has already mentioned, we want to encourage local purchasing, and that helps people purchase items which are in season as well. And so that's a big aspect of it. And next slide, please. In terms of waste reduction, we know this is really important. Globally, 30% of our food is wasted, but we're not only focusing on food in terms of waste reduction. We want to talk about event materials, to choose digital materials over printed handouts, using QR codes for participants to use the QR codes to get important information about the conference rather than physical handouts at the meeting. We want to talk about reusable cups, for example, reusable cutlery instead of single-use items, and that could include things like communication before the event to ask participants to bring their reusable cups, for examples. But this also applies to displays and other items at a conference or a meeting. In terms of waste reduction of food, we want to encourage composting, but we also want to encourage recycling and appropriate waste disposal of other parts of the conference. Good signage, clear signage about where to put your waste is important as well. Next slide, please. In terms of the inclusivity and accessibility, we've talked about the universal meals when it comes to food, but we also want to include accessibility from a physical and sensory aspect. And we also want to include accessibility, inclusivity from offering virtual options for conferences and meetings. Some people don't have the capacity or the financial resources to attend meetings in person. And I think that now there really is no excuse not to have virtual options available for many of our meetings. Next slide.
Okay, back to me. So now we're going to do something that I've not done before. So hopefully this works okay. We've done it for other webinars and it was great. So we want to get your feedback as participants who are presumably thinking about how to run their own sustainable planning for sustainable meetings and events. And we're also going to be using the feedback that you provide us in the development of our document, just to ensure that it is actually reflecting what people need and what they want. So if you scan this little QR code in the corner here, this will take you to the questions, and you can just type it in and we'll see it. As you say, we don't see your name here, so you can write whatever you want. The question is, do you think your workplace will be interested in something like this? Absolutely, yes. Okay, great. So try to, and you can think of like, it doesn't, if it's not like your workplace, if you volunteer somewhere or anything like that, that would be great to hear. Okay, so we've got unanimous yes. That's great. I'll let the last couple, I can see people typing. I don't know if everyone can see that, but we'll wait to see what everyone else is saying here. Handy to have a relatable resource all in one place. Yes. Yeah, I think because it's like, for all of these things, there's so much information out there all the time. And it's like, what is right? You know, it's always changing. It's like, what is right? What is practical? What's been done? I think that's something that we try to strive for in all the guidebooks that we create, is to kind of like bring all the confusion to one thing and then make it something that's easy to engage with, so people can take it and run with it and then make it fit within their setting. Might be some pushback, yeah. Okay, thank you. This is great. I'm going to go to the next question. What are some topics you would like to see in a sustainable conference guide? So we have covered some things that we are going to be putting in. So you can even say in your response, like, I would like a focus on this area that you already discussed, but if there's any other areas that you think would be interesting or would be helpful for you when you're planning your own events or meetings. And like, you can think of meetings from group meetings, like with 5 people, to like 1,000 people conferences. We really want this guide to represent the various types of meetings that we have within healthcare, because there are so many different kinds that we facilitate. Everyone can see the answers that I see, right? Like, you can all see that, right? Okay, great. Lanyards, yeah. It's like funny things like that, like the tiny little materials that it's like, what do you do with these? People like them and people like to have little name tags. I know this is one idea that, so Peach is running a conference on May 21st. Tickets are still for sale. I'll do that little pitch now if anyone wants to attend. But lanyards are something that we kind of struggled with as well, as we want our conference, you know, we can't have our conference not be sustainable. So what we're doing with lanyards is, one of our partners in McMaster is running their own conference right now, actually. And they're getting all of their participants to return the lanyards to them. And we're just going to be borrowing those lanyards and asking our participants to return them as well. So we've done one bulk purchase of lanyards in a different department, and we're just going to keep sharing them back and forth until they basically fall apart. So that's our solution to the lanyard problem. There are probably better ones, but that's one thing that we're doing. Okay, I'm going to go through these and see more. ID badges. Yeah, and also for lanyards, I said, why don't we just use stickers? But some people said people won't want to put stickers if they have like suits and things like that. So maybe that's not a very practical solution. Need to provide a business model, ROI, and other language that decision makers will understand. Need to make our case. Yeah. One thing that we learned when we were making our business case and implementation guide was, we can have all of these great stats and findings and even case studies of where, like Leanne was saying, in New York, 98% of patients that receive the plant-based meals like them. But when we actually spoke to healthcare leadership, they were like, yeah, that's awesome, but like, how much is this going to cost? Like, we can't spend twice as much money. We don't have the budget to spend twice as much money. So that became a big focus of ours, is like trying to find all the cost savings and the benefits, and also like accurately reflecting the price of these things to give kind of a more practical understanding of what we're proposing here. That is something, yeah, that's a great point. Slide deck. Merchandise menu items, transportation. Yeah, transportation is like food and transportation are the big contributors, obviously, as we've talked about. So that's something that's something that is going to be included. The negative environmental, yeah. Agriculture. How to stay within budget, yes. Swag. Swag is another thing. It's like people want to receive swag, and as a conference attendee, I like receiving the swag, but you also don't want a bag of garbage. Whoops. So yeah, how do you make that sustainable? One thing actually we're doing at our conference is one of the, not to give it away to people who are coming, but one of the swag things is like an edible item from a local store. So that might be like one kind of way, but I guess that's difficult. That's easier for a conference of like less than 500 people, but if you have more than that, at what point does it become unsustainable? I don't know.
On that point, Fiona, there's we've done at our previous conferences where we have discount codes for various online things. So you just put that in the program or send it out to your attendees, and that's one way we've done it.
Oh, that's a great idea. I didn't even think of that. Yeah, because that's like a swag thing that people like and will probably actually use rather than like the 10,000 pen that you receive, branded pen. That like I've got like 3 right around me from conferences. I guess I use them, but still, I'm gonna throw them out eventually. Like there's a lot of plastic in one free pen. Suggestions of distributing food instead of throwing it away. There's one organization that's called Second Harvest, and they work with conference and events venues to distribute food after the event is done. They've got a lot of rules on like how the food is packaged and how you provide it to them, but they basically, if you are throwing a large event, look up Second Harvest. They will work with you on how to prepare your food to provide them after the event is over. They will come, they have volunteers that will come and take your food, and then they distribute it to various food banks or other organizations that also work within their rules to ensure that someone actually eats that food that you've purchased and you're not just throwing it away. I believe they're all across Canada. Second Harvest, say it again. They do a lot of great work. The lanyards should be clips for lapels. Oh, that's a good solution too. You know about the cloth. Because cloth is something that takes a really long time to break down in landfills. Like actual like fibers take a long time, more so than you would think. Sometimes I think like cotton and stuff won't take that long, or paper, but it does take a long time. I don't know the whole science behind it, but it takes a long time for fibers to break down. So cloth lanyards, yeah. Up-to-date data to assist with, yeah. Okay. I've got a few more people typing, so we'll wait for that. Providing free or reduced cost virtual tickets, and then having a live stream going. Yeah, and I think we said in our presentation, after COVID, a lot of conferences and large meetings do have a virtual option now, which is great for many reasons, but to reduce people flying to conferences is important. And even like going from city to city, like I am in Hamilton, a lot of conferences are in Toronto. So it's not a super far drive, but it is still a drive or a train or something. If I could attend virtually, I mean, I don't want to do that drive. I don't think anyone likes doing that drive. So if I could attend virtually, I would much prefer to do that. So it takes away my carbon footprint from being in the venue, from eating their food, from touching their things that are going to go in the garbage. I guess you miss out in the person to person, but if you set up the conference so that there are like virtual breakout rooms, or there is some sort of component where you can network with people, then it's kind of a win-win. A checklist that shows instead of X, do this. Yeah, I think a lot of so when Leanne was covering the products that have been made that are out there that we're going to be reviewing and kind of like compiling all the best points, a lot of them are set up in checklist format. And I think it's because like people who plan events are busy, right? You don't have time to sit there and like parse through all this document. So they have like a checklist format, which I think is great, and we'll probably try to emulate a bit in ours. We'll wait for the last person to type, and then we'll go to the next. I think I just have 3 questions, and then we'll have some time for Q&A. Zara and Leanne, do you want to add anything to what I'm saying?
Oh, that's absolutely great. I'll say one of the things that have come up when we've been talking to our national organisation to provide virtual options, because they have not, is that they have told us actually that providing a virtual option increases their cost significantly because of the technology, which is interesting. So that's why they don't want to actually do that.
Yeah, that's interesting.
Yeah.
A nuisance. Yes. Okay, let's go to the next one. There, yes, that. Cool. Okay, do I just have 2 questions? What are some topics? Okay, I guess that's all my questions. Thank you. These are our references if anyone wants to check out those. And maybe in the last 15 minutes, we can open the floor to questions and also further collaboration. Like if you have any ideas that you think would be helpful. I'm going to stop sharing my screen so we can see our faces a bit more.
I think, Fiona, the other question we thought we might put out was, what pushback do you think that you would receive if you put this to your people, and what those pushbacks might be so that we can start thinking about them when we're making this guide?
Yeah, I don't know why that didn't. We'll blame Slido for that. But if anyone can think of any pushback, if you could put it in the chat, or just Zara, user, are people are able to talk now?
They're not able to talk in a webinar, but they're able to type things into the chat. So I'd say if they have answers to your question, maybe we can keep it in the general chat for right now, and then we can move over to Q&A.
Okay. Okay, so Carolyn says pushback cost of virtual, yeah, for sure. And then food not as good. Yeah, I think that's something, that's why we want to avoid labeling. I think people can sometimes be automatically biased. They say like, oh, vegan or vegetarian, they're like, it's going to taste gross, or even like gluten-free. They automatically think it's going to be yucky. And that's where, like, I guess, caterer selection comes in. If you can cook, you should be able to cook plant-based items. What do you think about that, Zara?
I think that people are often surprised that the plant-based option is very tasty, and that's one of the things we do at our conferences, that we always do the 100% plant-based, and the feedback is always, oh my God, that's really tasty. We didn't think it would be tasty. So I think that experiential part of it is really important, and also to then get feedback from your participants after the event is really important, like what works, what doesn't. Leanne mentioned already when they did the New York Health and Hospitals pilot and implementation, they did do patient satisfaction and found more than 90% of patients were very satisfied with what they were given. So actually in the research, the satisfaction rates are high, and I think it's important for us to monitor that aspect as well.
Someone said pushback could be political. Yeah, sometimes with food things, people get like oddly defensive and political about food things. I guess not oddly, it makes sense, but it's also like, it's just a meal, So one thing that we suggest in our business case as well, and Zara said it, was like, we don't label, things are not labeled vegan or vegetarian, even for like low waste or low energy things. Like, I don't think you necessarily have to label that. Just do it as the default, like by default, think of it that way. Like, you don't have to say biking is a sustainable option. You can say biking is easier than driving through downtown, or you get to see this beautiful pathway if you bike, or it's all about how you position it. And then, yeah, in our business case, we have tips on the business case and implementation guide for sustainable menus in health services. Talks about like quick wins or like strategies people can take. And one of them is, when you label things, Zara touched on this earlier, but when you label things, don't say vegan. So say, instead of like even like, I don't know, veggie burger, you say like juicy burger, or just burger or something. For soups, like, don't say vegan soup, just say vegetable soup. things like that. It can kind of, I don't know, calm people down. Um, push back the disparity between planetary view of diet and current health fitness trends, high in meat protein. Yeah, so when we're talking about like health, there's a lot of differing opinions about what is the healthiest option, right? And a lot of people feel strongly about that because they kind of will base part of their view of themselves on that. So again, I think that's about labeling. Like this is, if you are throwing a conference and event, you're, I think, stick to your lane a bit. You're not trying to, like, we hope that people will learn, like if you are throwing a sustainable event or a meeting, you are hoping that people are going to learn the practices that you're showing and will take those into their everyday life, maybe take them back to their workplace. But also the goal is not to transform this person's life entirely, you know. We don't want to step on anyone's view of themselves or how they live their life necessarily. I mean, hopefully, but this shouldn't be something that's like shoved down people's throats. People unwilling to try the food. Yeah, it's definitely a pushback that you have to consider when changing an entire menu. Yeah, Vancouver had a top chef designing the menu. Is that available? Yeah.
You have to have your food services on board with this. You can't do it otherwise. But there are organizations that will help you and help provide trainings for your food services people. So Greener by Default will come and work with you. Nourish will work with you. Forward Food will work with you. So there's actually lots of resources there for you if you want to go down that path and if your leadership is open to doing that. I would also say that in terms of the disparity between perception of health and sustainability, I think it's very clear actually, you know, there is nutritional consensus in all the guidelines for plant-based eating as the most healthful way of eating. And there have been more data, more papers coming out looking at the co-benefits in terms of health and environment. So the Eat Lancet commission, which provided their report in 2019, and it was 36 scientists from 17 countries came together to provide a planetary health plate. So that was a plate that was going to be healthful, that was going to be able to feed a population of 10 billion by 2050, but keep within planetary boundaries. And the studies that are coming out after that, using the Eat Lancet planetary health menu, are showing, you know, reductions in mortality, reductions in cardiovascular disease, reductions in cancer, and the benefits in terms of greenhouse gases and land use, etc. So the data all supports the common benefit in terms of health. But yes, you're right, because of the social media and because of all these fad diets, there are people following these extreme diets, and it's really unfortunate. These low carb diets actually have not been shown to be good for you in the long term, even though in the short term they might be beneficial. But as Fiona said already, these are just events. It doesn't mean you have to change your entire life. But if we were trying to change people's entire life, you know, just like New York Health and Hospitals, did they send their patients home with menus, with recipes? And so their goal is to then continue the education. That's a further goal down the road. But, you know, that's one of the things that people can think about doing to try and keep that going in their personal lives.
Mm-hmm. And a lot of people here have mentioned working with national healthcare organizations like CMA and the like. And yes, totally, that is something we hope and plan on doing, engaging with them and kind of getting their feedback first of all, and then working with them to integrate these into how they throw their events or how they work with partners. Does anyone have any questions? We've kind of gone over some pushback and some suggestions, but any questions for us in the last 5 minutes? Maybe like one question. I also put in the chat a link to our business case and implementation guide. So this guide is written for like the viewpoint of healthcare leadership, but if you are anyone working within healthcare, there are a lot of great resources that are linked to it that you could potentially take to your department leader, or even if you have like a green team, or if you want to do something on your own. Like there are programs that are listed, especially in the implementation guide, that don't have to be operation wide. Like they could just be like within a team or something. Is plant-based diet cost-wise realistic for individuals living on a fixed income? Zara, why don't you take this one away?
I think this is another one of those myths that are being perpetuated. But again, if you look at the data, it is showing, there are several studies showing that plant-based eating is actually better for your budget. And we know, obviously, if you're going to be choosing these, very highly processed meat alternatives like Beyond Meat, for example, you are going to be paying more for that. But, beans are extremely cost effective, so incorporating beans into your menu instead of red meat is something that is going to be beneficial. And Leanne already mentioned that the New York Health and Hospital save 59 cents per meal. They've had a cost savings of $500,000 per year by instituting the plant-based menus. So in terms of your personal grocery bill, it's going to be helpful. You buy things in bulk, you buy frozen, you buy, beans. And also in terms of the institutional catering, it seems to be beneficial as well. So I think that's another myth that we're trying to bust. And when you look at Fiona's peach tree, in terms of the cost and the actions, actually plant-based foods is actually lower down on the cost. You're not actually paying extra to do that.
Question from Holly. Yes, this is going to be Canada specific. Thank you. Okay. We've got 3 minutes left. Is there any more questions? I put my email in the chat, and Yusra is going to send a follow-up email anyway. But you could also just reach out. Okay, well, if there's no more questions, maybe we can end 3 minutes early. I would like to thank Zara and Leanne very much for giving us your time today and helping with this presentation. Your insights are invaluable to the work that Peach does around food, so thank you very much. And thank you, Yusra, for facilitating this. And thank you everyone for attending. This is great. Stand by for us creating this and releasing this. Please follow us on social media where you will be able to find the resource once it is created. We do have a newsletter. It will be attached at some point in that. This will be kind of a slow going, hopefully by the end of the year, we will have something. But if you have anything in the meantime, please email me.
We have one last question in the chat if you want to answer that quickly, sure. From Carolyn. Surrounded around suggested recipe sources.
Oh.
Sorry, what was that?
So it's Carolyn's message in the chat. She said, we attempted to start to include plant-based cooking for patients as a grassroots, starting to make a case for hospital-wide. Pushback was they don't like it. Do you have a suggested recipe source?
There are a few. So I think Nourish is currently doing a project where they're trying to create some new menus. Someone was just telling us this the other day in our food committee meeting. I don't know, Zara, if you remember.
Physicians Committee for Responsible Medicine have recipe options as well. And yes, there was another thing, which I can't remember either.
Can't remember. I will look. Carolyn, I will email you when I find that.
I think Laura also had her hand up, but Laura, maybe if you're able to type, could you put it in the chat? If not, I'll see if I can try to turn your mic on.
Oh, thank you. Holly is saying that Forward Food has recipes. They absolutely do.
Yes, that's right.
And Physicians Committee for Responsible Medicine actually have a whole bunch of resources for hospital food specifically. So you can Google that, and that's really, really helpful.
You could also reach out to Vancouver General Health. Just if you look up their articles, they have the physicians who are leading it, their email addresses, and they've been very responsive to us. You could always reach out to them, and they had a whole process for developing their menu that focused a lot on like local tastes. So you can reach out to them and see if they have like a process that they could suggest. I know they're working on publications, so there might be something out soon too for that.
And Greener by Default has lots of recipes as well.
Oh, recipes for cooking group. So many.
For cooking
Personal
group.
cooking. So many.
All right, if there's no other questions, I guess we can get to the ending parts here. So I would just like to thank our panelists for this really insightful presentation. Of course, if you were not able to watch the entire thing, it was all being recorded. So we're going to send a link to a viewing party to it after this as well too. But I hope everyone has a really wonderful day, and I hope you guys join us at our future webinars.